Bismillahirrahmanirrahim. I'm Dr. Syed Moin Islam Shah. I'm working as Assistant Professor Surgery at Suleiman Rochelle Medical College. Today, our topic is a very important topic. It is burn. So, the objective of this topic is to identify the types of burn and their causes, to understand the pathophysiology of the burn injury, and describe the principles of management of the patient with burn and explain the proper wound management technique for treating the burn and the scar. So, what is burn? What is burn? To define the burn. Burn, it is a response to the skin mucous membrane and subcutaneous tissues to the thermal and few non-thermal injuries. तो वो रिस्पॉन्स हमारी स्किन म्यूकस मेम्ब्रेन एंड सबक्यूटेनियस टिश्यूज का to the thermal and few thermal injuries. Thermal means hot, fire. This is thermal. I will go in detail now. So the types of burn there is a thermal injury, electrical injury, chemical burn, cold injury, ionization, radiation, and sunburn. So thermal injury, this is like scald, spillage of a hot liquid, flame burn, and the flesh burn due to the exposure of natural gases, alcohol combustion, combustible liquids. So the contact burn, contact with the hot metal, sub objects and materials. Everyone has an experience. सबका गर्म पानी से जलने का एक्सपीरियंस कहीं ना कहीं किसी ना किसी शक्ल में महसूस आप ऑब्जर्व करते होंगे. दूसरा हमारे पास जैसे नेचुरल गैसेस के अंदर कभी सुई गैस की वजह से आग लग जाए या कंबस्शन हो गई कोई लिक्विड गैस बर्शन गैस वगैरह जैसे हमारे पास बर्स्ट हो जाते हैं अक्सर घरों में आपने सुना होगा. तो दिस इज कंबस्शन combustible liquids. So the scaled, flame burn and flash burn due to the exposure of natural gases. So electricity injury, everyone knows electric current injury is very dangerous, but it is least common than the thermal injury. Chemical injury like alkalis and acids, cold injury which is frostbite, and ionization radiation and sunburn. Ionization radiation क्या होती है जिसमें रेडियोथेरेपी की जाती है वो आयोनाइजेशन रेडिएशन कहलाती हैं. Now, flame burn is more common. It is about 55%. Scalding, it is 40%. And remaining 5% is electrical or the chemical burn. In this chart, we will see that most common age group is 15 to 64 years of age. It is 60% of patients they are developing the incidence of burn. So remaining 1 to 4 years of old age is 20%, and 5 to 14 and more than 65 years of old age patient, they 10% they face the burn, the incidence of the burn. So the classification, how you will classify the burn? Burn may be two types, but according to the burn percentage of burn, which is burn severity classification, and that is mild, moderate, and severe burn. The mild burn, it is partial thickness of burn. It is less than 15% in adult and less than 10% in children. Full thickness burn is less than 2%. Can be treated as outpatient basis. But in case of moderate cases, second degree of burn is up to 15 to 25% and 10 to 20% in children. So like and third degree of between the 2 to 10% of burns and burn are not involving the eyes, face, ear, hand, feet, and perineum. That is moderate. While in case of major or the severe burn, second degree burn more than 25% in adults and children, and then more than 20%. All third degree burn of 10% or more, burn involving eyes, ear, feet, hand, and perineum. All inhalational and electrical burn, they are also included in severe burn. So burn with the features of a major mechanical trauma. So deepening on the thickening of the skin involved, the first degree. If the epidermis looks red and painful, no blisters, heals rapidly in 5 to 7 days, epithelialization without scarring, and it shows capillary filling. This is depending on the classification depending on the thickness of the skin involved. While in case of second degree, this is second degree burn, and the affected area are mottled and red, painful with the blisters, and heals with epithelialization, and heals in 14 to 21 days. So superficial second degree burn heals, causing pigmentation. Deep second degree burn heals, causing scarring, and pigmentation sensation is present. This is second degree. Here we are seeing that there are multiple blisters. This is second degree burn. Whenever you will see the blisters in the burn patient, always mark as a second degree of burn. Now on the third degree, the affected area of the SHAH is charred and parchment-like, painless and insensitive with the thrombosis of superficial vessels. It requires grafting. SHAH denatured, insensitive, contracted, full thickness burn is called ischial, and these must heal by re-epithelialization from the wound edges. Now the fourth degree involve the underlying tissue like muscle and bones. Whenever the patient develops severe burn and the muscles are involved or the bones are also involved, it means it is fourth degree burn. This picture again, this is a first degree burn, this is only hyperemia, and second degree burn, there is a blisters, and in case of third degree, it is deep burn. Now, another classification depending on the thickness of the skin involved, the partial thickness or the full thickness of burn. Partial thickness, it is either first or the second degree of burn, which is red and painful, often with blisters. While in case of full thickness burn, it is the third degree burn, which is charred, insensitive, deep, involving all layer of skin. So in a clinical practice, we always classify the burn patient into partial thickness and full thickness of burn. How you will assess the burn patient? First, Willis rule of 9 is used for early assessment, and using a Lunder-Brauder's chart is a better method for assessing the burn wound, and here each part of the body is individually assessed for involvement of burn. The patient's entire hand area is 1%. So the clean piece of paper is cut to the size of hand, and through that percentage of the burn is assessed. The 44-degree set temperature takes 6 hours to cause the deep burn, while on the 65-degree takes 45 to 60 seconds to cause the deep full thickness burn. The burn is a dynamic wound, and so assessment should be repeated at regular interval. So this is rule of 9. What is rule of 9? Rule of 9 means head and neck. Rule of 9 here we will see in adult, in children, and in infants. So in head and neck it is 9%, in children it is 18%, while in infants we will include 20%. So any patient who came to you with the burn only on head and neck, in case of adult it is 9%, while the same head and neck is involved in case of burn, but the patient is a child, you will mark as 18%, while in case of infants it is 20%. The front of the chest and abdominal wall, 9 into 2, front of the chest is 9, abdominal wall is 9, 9 into 2 is 18%, and same in the children it is 18%, but in infants front of the chest is 10 and front of the abdomen is 10 into 2, means 20%. The back of the chest and abdominal wall, again it is 18%. Back of the chest 9%, and back of the abdomen, like the lumbar area, it is 9%. It is 18 totally. while in case of children it is 18 also, but in infants it is 20%. The lower limb 18 to into 2, it is 36%. 13.5 into 2 is equal to 27% in case of children, while 10 into 2, 20% in infants. Upper limb same, 9 into 2 it is 18, and children it is also 18, but in case of infants it is 10 into 2 is equal to 20%. And a perineum in adult and in children is same, 1%. This is rule of 9. Again, this picture will also clear, I think this picture will also clear your concept. The head and neck is a 9%, chest is 9, abdomen is 9, back of the chest is also 9, and back of the abdomen is also 9, arm 9, back of the arm 9, it is 18, like an anterior thigh and anterior leg, it is 9 into 9, 18%, and the back is also 18. So in children it is same, but in face in children it is 18%, while 9 into 9 and the same as in adults. So this is a load and a broader's chart. Here we will mark each and every area of the burn in a percentage. Like head, if the patient has developed burn on head, you will mark head, mark 9%, and neck also, anterior of the trunk, you will mark 9%, or how much the area of the burn is involved, you will mark. As I have mentioned in previous slide, that mark the hand of the patient on a white paper, sterile white paper, and measure the percentage of burn with this hand markings. So clinical features, first of all, we will take the history of the burn, and there will be severe pain and burning, and a patient will be in noxious state, and there will be a tachycardia, tachypnea, and fluid loss. So in a severe degree, features of shock. The tolerable temperature to a human skin is 40 degree for a brief period. So हमने देखा अक्सर, ये हमारी एक्सपीरियंस में रहा कि जो बर्न का पेशेंट आएगा पेन के अंदर होगा, बिल्कुल टेंशन में होगा, एनॉक्सियस स्टेट में होगा. When you will examine the patient, first you will palpate the pulse. This will be the tachycardia. हार्ट रेट ज्यादा होगा पेशेंट एनॉक्सियस होने की वजह से, या गैसेस, बर्न की गैसेस की वजह से टेकिपनिया होगा, टेकिपनिया एंड फ्लूइड लॉस होगा उसके अंदर. सो दिस क्लासिफिकेशन ऑफ द बर्न एंड द क्लिनिकल फीचर्स, क्या क्या होगा? बर्न की क्लासिफिकेशन एंड द लेयर ऑफ स्किन इन्वॉल्व, क्लिनिकल प्रेजेंटेशन जिसमें पेन, कलर, ब्लिस्टर्स, एंड व्हाट वी विल टेस्ट टच, pressure, and capillary filling test we will do. So in case of first degree of the burn, only the epidermis is involved. And if in case of epidermis is involved, there will be severe pain, erythema, and blisters are absent in case of first degree burn. While on touch, sensation will be there, pressure sensation will be there, and capillary filling is present. So in case of second degree burn, superficial dermis or the deep reticular dermis. That means dermis is involved. In case of first degree, epidermis was involved. In second degree, dermis is involved. But in this case, there will be severe pain, erythema, and blisters are there. But this is touch sensation and pressure sensation will be present, and capillary filling is also present. In case of third degree burn, which is also known as the full thickness of burn, so epidermis and the dermis is involved. So it is usually आमतौर पर इसमें क्या होगा, पेनलेस होता है. तो फर्स्ट डिग्री और सेकंड डिग्री तक तो पेशेंट पेनफुल होगा बर्न का, लेकिन इन केस ऑफ थर्ड डिग्री ऑफ बर्न देयर विल बी नो पेन, pallor and blisters are absent, touch and pressure sensation is also absent, and there is capillary filling is also absent. And fourth degree of burn, skin and the subcutaneous structures absent, pain, pallor, again no blisters, and pain and pressures are also these pain and touch and pressure sensation will be absent, and there is capillary fillings are also absent.